you, this is a healthcare question. You might have seen that in the news lately. Well, this week the federal government produced a cost analysis of the recently passed healthcare bill that estimates the startup cost of the program at $1 trillion, with a T, $1 trillion. Shortly after the bill had been passed, CNN reported that AT&T, Verizon, John Deere, and other companies had done their own cost analysis. And they concluded it would be less expensive for them to drop health insurance benefits for their employees and pay the government fines than it is to continue paying for their employees' health benefits. If that happens, it's going to push more working Americans into a government-sponsored plan, which will drive up the costs associated with administering the plan and subsequently our taxes to help fund the expansion. Questions. Do you see inadequacies in our current healthcare system that need to be addressed? Is the current healthcare bill good? And what course of action would you pursue to drive down the cost of healthcare and expand coverage to those who are truly needy?
The healthcare system, boy, $1 trillion, this one. Healthcare is not something guaranteed to any of us in the Constitution. The healthcare bill that they passed, and the reason the small businesses are being smarter, and they realize by dumping them, it's cheaper and pay the fine, falls right into the hands of what the government wants us to do. This is their plan. It's not about assuring health care because they're worried about 15% of America that's not insured. This is exactly what they want us to do. Depend on the government. This is way past health care. This is 1/6 of our economy going over to the government. This is a prescription, absolutely, for disaster. But the government wants your dependency on them. This is a part of the socialized democracy. Is our current system good? Absolutely. We have the greatest healthcare system in the world. And I know this firsthand. I'm a cancer survivor. And I'm also the mother of a cancer survivor. And if we lived in Canada or Europe, neither one of us would be alive today. But the fact that we have good health care and we have good insurance, but yet it's not affordable. But we do not want the government taking over our health care. They run so much of our lives, but yet they can't even run the post office or Amtrak. And they're going to manage our health care? Not on my watch. When I'm your congresswoman and I go to Washington, you better believe I will do everything I can to repeal this health care bill. And I hope before I get there that the attorney generals from all the states will continue this lawsuit. And if not, Congress will hopefully defund it, because already the price has gone above and beyond what they even said it was going to be. Course of action we should take, very simple. As Republicans, we all know those great ideas. First of all, tort reform. The reason that the lawyers support the Democratic Party is so that tort reform doesn't pass. 80% of the money that goes to the Democratic Party comes from lawyers. We know that. And in this current administration, we would never get that passed. And most importantly, portability. I'm in an industry where customers come to my restaurant and they say, oh, Karen, I'd love to move to South Florida, but I can't take my insurance with me. They would come now. So that's a thing that would help our economy grow down here, is letting it be portable. And most importantly, too, open up nationwide. We all buy our car insurance across borders, our cell phones. Competition drives down the price. That is what will happen. 3 simple things that don't cost you and I, taxpayers, a dime. But our government doesn't want that. They want control. And this is why I'm going to Washington as your congresswoman to fight that control.
Thank you. Robert.
We don't need the applause. It's all right. It's not about us. I think I'm just aghast when I read in the paper today that it's now $1 trillion. It's like, didn't they read the report when it was signed it was going to be 2.5? It hasn't stopped. It's going to be 2.5 trillion when they're done with this thing, because we still, like Nancy Pelosi says, they have to sign it to find out what's in it. They still don't even know what's in it. Folks, I'm an entrepreneur, and as I run my business, there's 3 things you do as a business person. You identify the problem, you create a solution, and then you implement it. It's as simple as that. This health care bill is a scam, just like the cap and trade is a scam. And as Karen pointed out so well, It has nothing to do about fixing the healthcare system. What's the problem with healthcare? Every dollar we spend, 65 cents of it is the government. That's your Medicare, Medicaid, S-CHIP, and your VA. The other 35 cents is you and me. Now, I've had bronchitis all week. I access this system. It's fine, except I might be upset with what I paid. But that's enough. But that we can fix. That's called capitalism. We can fix that portion. But what is broken is the government portion. And you don't fix a government program by creating a larger government program. So, what you do, as what I wrote about in August of '09, when Debbie wouldn't come back and talk to us about this town hall thing, when she said it was already going to pass before the August break and all that stuff. Well, we wrote an op-ed, Ed Lynch and I did, and thank you, Mr. Mann, you published it in September. 6 weeks wasn't too bad. But it was still an issue, so I'm happy. And in that, we created a 5-point tax-free system to fix the healthcare problem. And some of them you mentioned. Tort reform. Listen, it's already done in Texas. Texas has tort reform, and more doctors came into Texas, and they lowered their malpractice insurance in half, and therefore the premiums that people paying for insurance in Texas went down by another 20%. So the consumer saved 20, the doctor saved 50, and there's more doctors to choose from. What a concept. Then the second thing is tax equivalency. You got to remember that the whole system was based on unions. Back in the 50s, the unions created this new thing called health care by your employer, which is tax-free. A different way to get tax-free remuneration to the employee that's a union worker that the average schmo doesn't get. Well, we have to equalize the taxes between the individual plan and the employer plan. Either you tax them or give the same benefit to the employee or the individual. That creates a bigger pool. And that way a lizard, when you enter this to the 50 states, not restricted to by your only state, and a larger pool, you can let a lizard save you 15% in 15 minutes. This is what we need to do, which are all tax-free solutions. We've written about it, we know what works, we got to repeal the bill, we have got to unfund it if we can't, and we have to start over.
Thank you, Donna.
I'd like to echo those sentiments. I think my colleagues are right on the money so far with healthcare, but there's something else we need to focus on, and that's government regulation and government regulated industry. The insurance industry is a government regulated industry, and like the energy commissions and so on, when you're allowed to make a certain percentage of profit in your industry, they make sure they spend a lot of money. Let's say you're allowed to make 10% profit. If you spend $1 million, 10% of $1 million, that's what you make. But if your industry spends $1 billion, you still get 10%, but it's 10% of $1 billion. We've been conditioned to confuse healthcare with welfare. Our healthcare is different than our welfare. The insurance industry and the government have gotten involved in our welfare. We all maintain our own cars. We change our oil, we change our tires, our brake pads. We do what we need to do to our cars to keep them healthy. But somehow we believe that we need insurance. The insurance industry, if you're going to go for a routine doctor visit, if you're going to go for a routine doctor visit to get your cholesterol checked, get your blood work, get your yearly physical, you don't know what that's going to cost. You put your little blue card down or your little green card down, you pay your $35 copay, and you say, hey, I paid for it through work. I paid for it. You become a number to your physician. You become a number to your insurance company. But your insurance company must first, in order to become your pay service, they must first take, if that doctor visit was $100, they're not taking $100 from you. They have to take first much more than that from you because they have to pay for their building, their employees, their light bill, their profit sharing, all of that. So to become a pay service for welfare, I say we have to reform the entire system. Yes, tort reform, yes, repeal the bill, yes, all of that, but we must be reconditioned and take responsibility for our welfare. Reestablish personal relationships with your physicians. So when you come in and you say, I want my blood work, doc, how much is it going to be? It's going to be $100. Gosh, there's a doctor down the street that does it for $75. Oh, what the heck, I'll do it for $75. In other words, you're not a number. You're not a number to the insurance company. Your welfare is your responsibility. If we could take welfare out of the insurance industry, there would be enough money left. What your employers pay on your behalf, what you pay on your behalf, there would be enough with that to cover catastrophic care, pre-existing conditions, and any accidents that you may have, because your welfare would be paid for only by you. They wouldn't have to collect a lot more money from you first in order to pay it on your behalf. We don't need a pay service. We need a relationship with our physicians.
Thank you.